Welcome to the channel Naturopathy Cure and Healing. I am Dr. B K Jha DNYS, practicing naturopathy since last 6 years. I have cured many patients without medicine. Today I am going to discuss about dengue fever, its symptom, cause and treatment. We naturopaths have a different view about the dengue fever. Dengue fever often comes in the period when summer ends with too much heat absorbed in the earth and heavy rainwater percolate in the earth, thereby emitting heat and creating such an atmosphere when germicide breeds at its extreme height. This time is the time when mosquitoes breed and bite in day and night whenever they get chance. Dengue fever is also known as breakbone fever. Its cause is the same as that of influenza, typhoid, and other fever which repeat in the Earth's cyclic motion. The main cause of this fever is accumulation of foreign and morbid material in the body which cannot be ousted by the body due to lack of life force. The most responsible cause of this fever is our lifestyle, which is wrong. We do not give adequate time to body to rejuvenate the self-healing system. Body's cyclic watch at night. There are special symptoms of this fever. It comes suddenly and the temperature rises rapidly. The temperature rises again and again even after coming down. In the beginning there is pain in the joints and bones. Then the face becomes red and small pimples appear all over the body. Dengue fever is a mosquito-borne tropical disease caused by the dengue virus. Symptoms typically begins 3 to 14 days after infection. These may include a high fever, headache, vomiting, muscles and joint pains, and a characteristic skin rash. Recovery generally takes 2 to 7 days. The patient becomes restless, the fever goes up to 102 degree Fahrenheit to 105 degree Fahrenheit. The fever subsides in 2 or 3 days, but it again appears after 3 or 4 days. The main unfortunate cause of this dengue fever is the reaction in blood vessels where it neutralizes the platelet of the blood in the whole body. Excess heat generated by the body affects nervous system and body develops a separate vein for communication. Thus it disturbs the whole immune and disorders the natural way of communications. Many people experience no signs or symptoms of a dengue infection. When symptoms do occur, they may be mistaken for other illness, such as the flu, and usually begin 4 to 10 days after you are bitten by an infected mosquito. Dengue fever causes a high fever, 104 degree Fahrenheit, and any of the following signs and symptoms: headache, muscles, bone or joint pain, nausea, vomiting, pain behind the eyes, swollen glands, rash. Most people recover within a week or so. In some cases, symptoms worsen and can become life-threatening. This is called severe dengue, hemorrhagic fever, or dengue shock syndrome. Severe dengue happens when our blood vessels become damaged and leaky, and the number of clot-forming cells, platelet, in bloodstream drops. This can lead to shock, internal bleeding, organ failure, and even death. Warning signs of severe dengue fever, which is a life-threatening emergency, can develop quickly. The warning signs usually begin the first day or two after your fever goes away and may include severe stomach pain, persistent vomiting, bleeding from your gums or nose, blood in your urine, stool or vomit, bleeding under the skin, which might look like bruising, difficult or rapid breathing, fatigue, irritability or restlessness, headache, muscles, bone or joint pain, nausea, vomiting, pain behind the eyes, swollen glands, rash. Dengue fever is a mosquito-borne illness that occurs in tropical and subtropical areas of the world. Mild dengue fever causes a high fever and flu-like symptoms. The severe form of dengue fever, also called dengue hemorrhagic fever, can cause serious bleeding, a sudden drop in blood pressure, and death. Millions of cases of dengue infection occur worldwide each year. Dengue fever is most common in Southeast Asia, the Western Pacific Islands, Latin America, and Africa. But the disease has been spreading to new areas, including local outbreaks in Europe and southern parts of the United States. Researchers are working on dengue fever vaccines for now in areas where dengue fever is common. The best ways to prevent infection are to avoid being bitten by mosquitoes and to take steps to reduce the mosquito population. Causes. Dengue fever is caused by any one of the four types of dengue viruses. You can't get dengue fever from being around an infected person. Instead, dengue fever is spread through mosquito bites and you have foreign as well as morbid matter within your body which helps virus to multiply there within the body. The two types of mosquitoes that most often spread the dengue viruses are common both in and around human lodgings. When a mosquito bites a person infected with a dengue fever, the virus enters the mosquito. Then, when the infected mosquito bites another person, the virus enters that person's bloodstream and causes an infection. After you have recovered from dengue fever, you have long-term immunity to the type of virus that infected you, but not to the other three dengue fever viruses types. This means you can be infected again in the future by one of the other three viruses types. Your risk of developing severe dengue fever increases if you get dengue fever a second, third, or fourth time. Complications. Severe dengue fever can cause internal bleeding and organ damage. Blood pressure can drop to dangerous level, causing shock. In some cases, severe dengue fever can lead to death. Thus, patients' blood platelet level must be monitored and all precautions to maintain platelet level to be provided for the survival of the patient. Women who get dengue fever during pregnancy may be able to spread the virus to the baby during childbirth. Additionally, babies of women who get dengue fever during pregnancy have a higher risk of preterm birth, low birth weight, or fetal distress. Treatment. When the fever comes, the patient takes complete rest on bed. To begin the treatment has to fast for 2 or 3 days to let the morbid matter melt down and goes out from the body. If the morbid matter is not getting out of large intestine, then take enema for 7 days to clear the place from morbid and foreign matters. Fasting gives relief and fever subsides in third day. He should be given liquid diet and fruit juice. He can take fruit also after 3 days. He should take lot of water during the day, but quantity should not increase 1 glass at a time. However, he could take as much water as he could, but one glass at one time is worked as medicine to clean the tract from stagnated substances. He should be covered with a fine thin blanket and a hot water bag under his feet or tie hot water bag in his legs so to stimulate sweating in the body. He should take bath with lukewarm water if the patient has a running nose. He should take hot lemon water after an interval of 4 hours to stop it. The chest pack should be put on chest and back. What is chest and backpack is hot water bag or bottle placing in both sides. In case of high fever, put wet mud pack on abdomen, wet cloth on head. If fever is not subsiding, then give him a cold bath. If patient has feeling cold, give him hot bath. Green leaves of holy basil are an excellent remedy of influenza and dengue fever. Therefore, he should be given 1 gram of holy basil leaves boiled with ginger mix. This would give him immediate relief. He should also be given turmeric powder mixed with milk at night at time of sleeping. I see the dengue fever will not visit you again in lifetime. Please view, like and subscribe this channel to see more videos like this. Please also write if you like Hindi or English so that it would be help me to make one of the two languages. Thanks for watching this video. Next I will see you with the next video, malaria fever. Thank you.